let's talk about decisions on surgery for a torn ACL. And right off the bat, before we get into anything, what is a torn ACL? And I think that's going to matter here. We do know that there's differences between ACL repairs and ACL reconstructions simply based on the nature of the tear. So let me give you some perspective. You know, I'm always going to be very open and clear on my biases. Number one, I work with and have access to who I believe to be the best sports orthopedic surgeons in the world, whether they be in New York, whether they be in Houston, whether they be in Chicago, certainly Los Angeles, et cetera, et cetera. The communication is not subservient. We've talked about that a lot. How do you get people to do that? I don't know, you just pick the right people. Obviously, when you have a positive relationship and a lot of high positive experiences, somewhat it's a little bit difficult to wrap my head around why somebody wouldn't get surgery. Regardless of the process that you undergo without having surgery, we know that the surgical process is very, very reliable. And we're actually not removing a lot of things. Obviously, if you're making portals, you're removing some bone, but I don't know that these long-term outcomes of ACL, particularly if you're using something that's from your own body, an allograft, I don't think this is a problem. I don't know why there's this so why did this swell even start? If somebody didn't want to have surgery, we already knew that you don't need surgery, you don't need ACL if you support the structures around the knee and you only want to do certain things. Have I read every single paper? No, so I really can't say that I am not in agreement of what I'm reading in the literature, but I also don't care. Like if you don't want to get surgery for whatever your reasons are, then that's okay. But I'm not familiar with anybody, and why would I expect somebody to come back to be a running back in the NFL type of level? And then this now extends to other areas where I had this jackbag suggest that this NFL player didn't need a pec repair. I don't know how to wrap my head around that. Now, let me give you another bias. For the last 2 years, only two, I have done the deep dive into the utility of stem cells. Why? Because I think I have access to some of the best stem cell physicians in the world. So, and there's more than one, and they all do kind of different things. Just to say stem cells is like saying you're a surgeon. There's a lot of different specialties and a lot of different operations that everybody can do. Now, I have a strong belief that stem cells are absolutely fantastic. In fact, as long as you're not spending the rent money, I don't know why somebody wouldn't get stem cells. You can say that there's not a lot of evidence that it doesn't do what you want it to do, but I think that's a little because there's a lot of people using stem cells that are super, super slappy and ready to take a big check just to throw stem cells anywhere. Well, at best, that's a 50-50 suggestion. If we're using stem cells or any type of decision that we're making that's very, very focused, then we should have a better reason to think we'll have a better result. So now, obviously, a lot of these non-surgical decisions for ACL are being motivated by the expectation of what stem cells can do. And here's the crux, and this is really maybe the most, at least in my mind, when I think about what I'm going to talk about, I got to make sure I get this one in. My opinion is this, is that if your ACL kind of looks like this, on the MRI, where if it was in fluid, it would be floating like that, I think you got a shot. I think you got a shot that stem cells can bring it together over time, provided, of course, we're doing all sorts of awesome therapy and training. I think you got a shot. Right before I was in Miami with Dave Paloka in 2017, if you recall, let's go back, in the wild card game the year before, that's when Ryan Tannehill had a partial tear of his ACL. Partial tears, by definition, maybe is this, where it's torn up here but not here, and that's a gross exaggeration of what that really might be. And that's no man's land. My understanding, I wasn't a part of it until I got there later in the summer. My understanding is that Ryan had stem cell procedure, and the ACL looked robust. It came back together, and Dave would explain that all off season they tried to tear his ACL by doing things like playing basketball, et cetera, et cetera. And he did great. We do know that was a partial. We do know that we know that it wasn't, relatively torn in half. And the Miami Dolphins surgeon would be very, very old school conservative. I'm not sure he was even part of this decision, but it seemed to work. And then, I don't know, maybe it was like the second or third week of training camp. Of course, the big giant dude is chasing him, and Ryan trips over the air and tears his ACL. Even though all summer and all off-season he was doing great, and then all of a sudden it tore. I don't know what that means. Does that mean that stem cells create an ACL that looks like it's big and strong but isn't? Is it like a hollow tube? I don't know these answers. But I do know that I believe that stem cells can bring something together when it's close. If your ACL is torn like this, I don't think there's any stem cells on earth that's going to do it. And I also don't think that there's any amount of elite training and rehab that is somehow going to stabilize a knee that isn't connected with some type of tissue. Connor McDavid maybe? I don't know. I don't even know if it's public, so I don't really care if I'm not supposed to be saying this. Somebody tore their ACL in the NHL, because I don't really know NHL players, and they absolutely restored it with the most elite forms of connective tissue, et cetera, therapists, chiros, people that I would really look up to and respect. And I would say, yeah, like if I think somebody's going to do it, it's going to be these guys. And they got it done. And obviously the nutrition piece would be critical in that as well. So it can happen. It can happen. I also don't know enough about the biomechanics of hockey to determine if the ACL is as important as it is in other sports, simply because you don't seem to hear about a lot of torn ACLs in hockey, unless I'm wrong about that. I think this is it's just interesting that there's such a dominant, I wonder if the individuals who are so aggressively in favor of non-surgical, what else are they really favorable? Do they believe the world is flat, or that we did or didn't land on the moon? I wonder if that's the type of person that's really so favorable. Are they putting all their money into Bitcoin? It's just an interesting question that I think of as it relates to this topic. Here's the last thing. What do we need to be really careful about? If you have an unstable knee, well, I'm not going to sit here and tell you that you should be in fear of anything. I'm pretty sure, though, that from the highest levels of reliable science, that an unstable knee might be more inclined to dislocate. And if a knee dislocates, meaning it's out and it stays out, that's a medical emergency, because if the popliteal artery is significantly compromised and you lose blood flow to your lower leg, it's getting amputated. I'm not saying don't give it a ride to have a non-surgical outcome for your torn ACL. I am saying that any joint that doesn't have ideal stabilization strategies is at risk of somewhat dislocating. You dislocate your shoulder, it really, really hurts. You might have a banged up shoulder for a long time. Dislocate your knee, that's a medical emergency. And we saw that, I think it was Robert Jones, who was at the height of his career, young career, when he was running back with the Patriots. And at the Pro Bowl, they were doing flag football on the beach. He dislocated his knee. It was never the same. I think he came out of Georgia. It might have been on the Patriots. I know he played for the Dolphins down the road after, because of course his rehab was arduous. And coming back from a dislocated knee, you don't hear about it very often. But obviously any type of instability in the knee, any type of compromise in the knee could put you into a different category for something that would just sublux, but now it's out and it stays out, and that is a medical emergency, which we saw, I'm pretty sure his name was Robert Jones, many, many years ago, and when the Pro Bowl was part of the weekend was some type of flag football on the beach. Maybe I'll make another video about training on the beach too. Yeah, I'm not against anything, because I think the motivating factor there is, like, what does that have to do with me? I just can't really wrap my head around why people are so excited to not get surgery for the ACL. Because maybe the very, very last thing I'll say here is, how long are you going to wait to find out that it doesn't work? We know ACL surgeries are going to work, provided you do the right things. You don't go to some doofus rookie surgeon. You don't do quadruple bundle. You don't do, and you get some really, really great rehab, meaning you start right away and you get ACL in action off T equals R plus. But let's say you don't do it, and now 4 or 5 months later, you're no better than where you were before. Do you wait another 5 months? At which point you would already been back playing full speed, with wondering why you maybe didn't do this sooner.